All right, our patient today, you can't tell, is a 28-year-old, 5'10", 195-pound male who had a radius fracture 8 weeks ago. He was immobilized at the wrist and elbow, meaning the wrist at neutral and elbow at 90 degrees for 6 weeks. Currently, he's having difficulty at fully extending his elbow. So his full elbow extension stops about here. Currently, there's no redness, swelling, or warmth in the area. It's not painful except for stretch being sensed on the anterior part of the elbow. And so today we're going to do some treatment on his elbow. So we'll rewind and let's say that we just met. Hi, JC, I'm Dr. Wilbanks. I'm going to be your student physical therapist today. And since you're having some difficulty extending your elbow all the way, I think it's because there's some shortened tissue on the front of your elbow from being like this for so long. So we're going to use ultrasound today. And what ultrasound is it makes sound waves, and those waves turn into energy when they go into your skin. It helps to warm that tissue up. And when it's nice and warmed up, then it's a little more flexible. So you're going to find it able to extend a little more. Okay, sound good? Yep. Do you have any of the contraindications related to ultrasound? Are you pregnant? Do you have any metal in the area? Let's see. Do you have a tumor or any other malignancy? No. Okay. So we're probably and allergies, jello. Okay, awesome. So let's do this. Let's have you. Actually, we're going to pretend that it's your left arm. Oh, okay. Look at that. So we're going to have you sit in this chair, facing forward, and just go ahead and let your arms relax there. And I'm going to put a pillow underneath the top part of your arm here. You can just relax and let your elbow kind of extend as far as it will go. So we'll pretend that that's as far as it can go. And my parameters that I'm going to choose, I'm going to select 1 megahertz for the depth because there's enough tissue that we're going over that I don't think it's going to do the periosteal heating, and getting some more depth to that penetration will be good. And if we did superficial, we may be missing that deepest part of the joint capsule. So I'm going to go ahead and set my machine for ultrasound at 1 megahertz, and I'm going to start with an intensity of 1.5. So if I do an intensity of 1.5, let's pivot for a moment and find a marker. Oh, here it is. So if I have 1 megahertz, that means we get 0.2 degrees per minute times 1.5 watts per centimeter squared is going to give me 0.3 degrees per minute. And my goal is to increase tissue extensibility. So I want a total tissue temperature rise of 4 degrees. And if I divide 4 degrees by 0.3, that gives me, I believe, about a 12-minute treatment time. So I could potentially bump this up and do, say, 1.7, which would give me closer to that 10-minute treatment time. So anywhere in this range would be appropriate. So we'll pivot back to Jason here. All right, now you comfortable in that position? And she's reclined back against the seat, so she's nice and comfortable for her treatment here. And I'm going to put some gel on your elbow. I'm going to put some gel on the front side of your elbow. This is kind of cold. Okay. All right. I'm going to turn my time up here to 12. And what this is going to feel like is probably about like that gel feels for most of the time. Once we get a couple minutes into it, you should feel some warmth. I'll ask you about 2 minutes in if you're feeling some warmth, and if you're not, we'll go ahead and turn the intensity up a little bit. And if you are, then we'll just keep going. And we're just going to let your arm relax like that. Does that feel okay to you? Okay, excellent. So now the one thing I need to fix before I begin is I need to be able to touch my machine and take care of JC at the same time. So going to go ahead and move my machine around so that now I can see my machine right here in front of me and I can see JC. A little further if I can. Okay. If you feel any discomfort in your elbow or if it feels really hot, just let me know and we'll turn your intensity down. Sound good? Mm-hmm. All right. So I'm going to get my gel going. Go ahead and press start. Make sure the timer's counting down. And it is. I'm just staying right in the area where that tension is felt. Some gel back up. And I'm standing in a comfortable position that I can do for 10 or 12 minutes. Is that feeling okay? Mm-hmm. Feeling anyone? A little bit. A little bit? Mm-hmm. If it gets too hot, just let me know. Okay. You think your bone is healing really nicely, and this is just trying to get that full elbow range of motion back. I think once we have that and we work on some strength in your forearm, you're going to feel good as new. Okay. So let's talk about your home exercise program. Or maybe JC's a smoker and we need to talk about tobacco cessation. Or maybe JC drinks excessive amounts of alcohol or is not managing her stress very well. So lots of different things that we can talk about. You feeling okay? Yep. Feeling warm? Yep. Alright, so we're going to say that we've come to the end of our treatment session. And I'm going to go ahead and wipe off JC's elbow first. And then the ultrasound head, which I would then wipe with rubbing alcohol. I'm going to inspect her skin, other than a little more gel. It's maybe a little bit red. It feels kind of warm. Do you have any pain or discomfort in the area? Excellent. So your skin's a little bit red. That's normal because we warmed it up. And now what it would be a good idea for us to do is I'm going to do some soft tissue massage while you try and extend your elbow. Or really anything that would be trying to work on elbow extension would be appropriate after that treatment. And then we'd maybe talk about your home exercise program and so on. Otherwise, do you have any questions? No. Wonderful. It was so nice working with you today. It was a great day. All right. JC's elbow is now fixed. So we're going to move on and talk for a second about the medial gastroc case from the exam. So now JC is a new person. We've already met, and what did we say, 3 days ago? 3 days ago, she had a tear in the medial head of her gastroc. So we're going to work on that today. So we've met. How's your calf feeling today?
It's all right.
It's all right, a little bit sore? Yep. So I think that one thing that might help it to heal a little bit faster is we'll do something called ultrasound. And what ultrasound is it's waves of sound energy that come out of the ultrasound head here. And we can use it for warming up a tissue, but we don't really want to do that right now because it's still kind of inflamed and angry and we don't want to make it any hotter. So we can do something called pulse ultrasound, which just means that the signal's on for a second, then off for a little bit, on for a little bit, off for a little bit. And what it can do is sort of vibrate the little molecules that are within your injured area, and it sort of massages the tissues and can help bring in the healing factors that we need to heal faster and to clear some of the junk that's in there from the injury. Okay, so that makes sense?
Yeah.
So I think that that'll really help. And we're going to choose our treatment parameters and pivot towards the board again. If you can see it. I hope you can. This is a pretty deep tissue again, so I think I'm going to go with 1 megahertz. And for my intensity, I'm going to try starting with 1 watt per centimeter squared. And I want my treatment time to be about 10 minutes. So if I did 100% duty cycle, that would be 0.2 times 1. So I get 0.2 degrees per minute. I'm going to pick a duty cycle of 20%. So I'll take my 0.2 that I got here times 0.2. Yes, 0.2 equals 0.04. Okay. Hold it up. Yes, you can bring a calculator to your skill check. 0.2 times 0.2. 0.04. Okay, it's 0.04. For some reason it was looking like 0.4. 0.04 degrees per minute. And I said I'm going to treat for 10 minutes, so total I would get 0.4 degrees of tissue temperature rise, and that's within our limits for a non-thermal ultrasound. We don't want to keep this up. It's a fresh increase. So I'm going to go ahead and use those as my settings. All right. So JC, let's go ahead and get you set up here. And what I'm going to have you do is lay on your stomach with your head facing that way. Is that comfortable with your low back, or would you like something? Would you like this under your hips? Or put that under your hips? Let's try that. That's better. And would you like something under your head? No. Okay. Then I'm going to put this pillow under your feet here, so it's nice and relaxed. And is this about the area where you feel the most pain? Okay, so let's say that I can feel the deformity here, and so I know the spot that I'm going to treat is right here within an area about twice the size of the ultrasound head. And here, here. If it was bigger than that, then I would do 2 separate treatments. That goes for the thermal ultrasound application as well. If the area is more than twice the size of the ultrasound head, you might need to do 2 separate treatments. I'm going to go ahead and set my machine for 1 megahertz for a 20% duty cycle at an intensity of 1 watt per centimeter squared. And I'm going to change it to a 10-minute total treatment time. And JC, I'm just going to put some gel on the back of your leg right where it hurts. So it just feels cold. And this really shouldn't feel like anything other than me moving the gel around on your leg. So if you feel any warmth or discomfort at all, just let me know. Okay. Okay? Go ahead and get my ultrasound head moving and press start. Make sure the timer's actually counting down. And then perched here comfortably where I could stand here for 10 minutes and do this. So what happens when you have a muscle tear is that the muscle gets damaged, and eventually it'll kind of get filled back in with some scar tissue. But we're going to do some work so that scar tissue is really strong and lines up sort of in the same way as the rest of the muscle, so that you're not as likely to get injured again. And again, maybe we talk about her footwear for running, or we talk about some behavior modifications like stress management, tobacco, alcohol, and so on. Alright, so let's say we came to the end of our treatment time here. It beeped at me because we were done. And again, I'll take a towel. Jason first. And on the ultrasound head, I would clean the ultrasound head with some rubbing alcohol. I'm going to go ahead and inspect your skin. It is not warm, it's not red, it looks perfectly normal, so that's great. And Jason, if you want to go ahead and sit up. And I think just because your injury is so new and fresh, And we've done some gentle range of motion. We're just going to put some ice on you for the last 10 minutes here, maybe 20 minutes, and then we'll see you again next time. We'll probably do the same thing. Any questions?
Nope.
Excellent. Very nice meeting you and treating you.
Yeah.
Have a great day.
Thank you.
Okay.